common questions that I've received is, what are some signs of stress in children, teenagers, adults?
So, I've been talking with a few people, and I think it's been really interesting. So a lot of people have, either what we call internalizing, which is more of that you're worrying, you're anxious, like you might have these body symptoms, your stomach hurt, things like that of anxiety and stress. And so we call that internalizing because it's things you feel. And then we have kids and adults that have externalizing symptoms of anxiety and stress. And that's the kids that kind of have more behavior outbursts when they're stressed out or when they're depressed or when they're anxious. And it's been really interesting because my internalizing kids are doing great right now because a lot of that stress was school related. So they're at home, homeschooling, and they're like, I'm going down on medicine on some, taking some off of medicine. My externalizing kids are the opposite, and they're having a little bit more difficulty, and the families are generally having a little bit more difficulty because generally that routine is helpful, and it's just hard to have a routine at home. I have, for those that know me or follow me, I've been very open about the fact that I have ADHD myself, and I also have 2 special needs kids. So having a routine at home, even as somebody who is the professional and the expert, it's hard. So I know everyday families are not getting up and having that school routine, and that kind of throws things off balance and can cause more behaviors. So a lot of times you'll see, if you have an internalizing kid, like I said, things might actually get better because they're not having to deal with a lot of those external stressors. But in other people, you'll see more behavior problems, sleep issues. A lot of people manifest stress with headaches or what we call GI symptoms, which is basically just stomach upset or nausea, vomiting, that kind of thing. And sometimes with teens, it's really hard to tell, right? Because teens kind of have an attitude. Anyway, part of being a teenager is learning that separation from family. And part of that separation comes with what we all know and love about teenagers, how they act. But some of that irritability and stuff like that can actually be anxiety and stress. So trying to tease that apart and tease out what's normal child behavior, normal teenage behavior, what's increased, what's different. That's where the art of psychiatry comes in.
For those of us who are psychiatrists, who are parents on this live tonight, what are some questions that, say, a parent could ask an infant or a toddler to figure out if they're being stressed, if the stress of COVID pandemic is taking a toll on the child?
I think just letting them lead the conversation. So my actual adoptive kids, I was going to say biological, my actual kids, legal kids, kind of know what's going on, but they're kind of at that stage where they are able to understand what I'm saying, but it doesn't really stress them out. Like they don't understand it on that kind of level. So with them, I let them lead the conversation of, we're out of, they want to go to school every single day. My kids love school, which is a great thing. But so every day I'm like, no, remember that virus is making people sick and we have to stay at home. No, we can't go to the Children's Museum. It's closed. So that I'm doing that simple, just kind of reassurance with them. Whereas with some of my kids, as in my patients, they come in and they're like, I'm so stressed about this coronavirus, and these sometimes are young kids, like 7-8 year olds, and like I've been having nightmares, I'm having sleep problems. So I kind of let them lead that conversation, like, what do they know? Tell me what they know. Kind of correct the information as you can, because we're all learning about the coronavirus right now. But correct that information as you can, and just reassure them that you're going to keep them as safe as possible and do what you need to do to keep them as safe as possible.
And I know there are people on here probably saying, what, a 7-year-old is seeing a psychiatrist? A 3-year-old is seeing a psychiatrist? What might be reasons for a 7-year-old or a 4-year-old?
Normally my younger kids, so like my toddlers up until about 6 or 7, is generally either neurodiversity. So either their parents are trying to rule out ADHD, autism, they're having learning problems at school, or anxiety. Sometimes kids that can't have depression and stuff like that, but generally the bulk of what I see is either one of those kind of neurodiverse categories or anxiety. Now, once you get to 8, 9, then we see it all: PTSD, anxiety, depression. Normally in kids, bipolar disorder is really very rare. Psychosis, frank psychosis, kids hearing and seeing things is rare. So I don't really deal with a lot of that. But so it's more of those anxiety disorder, depression disorders, and learning things.
Yes. And for a parent who might not be sure, how might a child with depression first present? Or is it very, very, very varied?
It is very varied. A lot of kids, so the kind of typical, what we learn and what we see about depression actually is not very common in kids. So that whole just withdrawing, actually being sad every day, that does happen, but that's not super common in kids. So normally a lot of time with depression, we see a lot of behavior issues. So generally, if I see a kid that has behavior issues, even if I can't, kids are actually pretty good at telling you, even the younger ones. But if they really can't, like if I can't figure it out and they can't really tell me, with the questions I ask and things like that, or normally the way we treat depression and anxiety is the same. So I normally treat for depression and anxiety first because those are the most common things. And then if that is not getting better, then I know to kind of, look for other things. But that's normally where I start.
Okay, that's good to know. So guys, I'm hearing, right? Children have mental health issues, but it can also be exacerbated during COVID and COVID-19. And if you're a child who has a diagnosis, it's important to be mindful. And I would presume, Dr. Rupert, stay in touch with the care specialists like you.
Yep.
How are you staying in touch with your kids?
Yes, my babies. So right now we have switched to phone visits. So we've gone from in-person to phone visits. So I talk to the parents, and I always talk to, normally with my in-person visits, I talk to the kid by themselves. For follow-up visits, I talk to the kids by themselves, then bring the parent in and talk to them. So the way I've been doing it on the phone is because normally it's the parent's phone that we're calling. Is I talk to the parents and then bring the kid in. So it's kind of switched, and they don't really have that alone time with me that they normally have, but obviously situations are different. We are working on a face-to-face kind of Zoom or Skype for our organization. So we're working on that. That's not up and running yet, but right now we're just been doing phone calls, and we have a patient portal that parents can send any questions or concerns they have.
And for those who are listening, how important is it that the child psychiatrist to meet with the child one-on-one without the family? Because parents are like, no way.
It's very important, and I actually do that with all of my children, unless they're too anxious for me to, because I'm not gonna, force a kid to be with me by themselves until they kind of, warm up to me and they make that choice. But I kind of make that standard. So parents know I'm not like kicking you out the room, so I can say, what is mama doing? Because it's really not about that. It's really about teaching them to have that relationship with me and being able to tell me things they might not be able to say in front of their parents, so I can make sure that they're, not having thoughts of want to hurt themselves and things like that. And also, especially in mental health, people have to learn to advocate for themselves. So I start that young with my patients. I'm like, you need to come in and tell me how your medicines are making you feel, because you're the only one taking them. Like, you're the only one in your body. So I need to hear from you what's going on. And of course, with kids, I obviously need to hear from parents too, but I want them to understand that I am their doctor and I need to hear from them.
That's really good. And how about your patients who are disabled or the ones in group homes? I know for a lot of the CDC guidelines, the CDC actually issued very specific guidelines during COVID-19 to check in on family members who are either in nursing homes or group homes, foster homes, etc. And regularly, the CDC recommendation to make sure. And certainly we've all probably seen that one that came out of Spain where the nursing home, the staff unfortunately left, and when they got to the home, they found countless people fatal. And so how do you do it, especially in this time? Let's say you have someone who perhaps doesn't communicate verbally. Signs that family members should look for that might be evidence of stress or evidence of someone like you needing to become involved.
Changes in behavior is normally what we see, especially with my nonverbal kids or adults. But all people are able to communicate in some way. So if I have a nonverbal patient, I'm always asking, how do they communicate? Is it signs? Is it picture boards? What can they do? And even if they don't really communicate to me or to people much at all, normally they're still able to understand. So I still talk to them and, have those conversations with them, even if they're not able to answer back, because I want them, of course, to feel like I'm their doctor, because I am, and I'm not just talking to the other people in the room. But most of my kids, my adults with developmental disabilities that live in group homes or live with their families, whatever, where I'm at right now, I've been really kind of impressed with the way the group homes here are ran. So when they see behavior changes, they give me a call. They are not shy about that. And they know they can. I mean, I encourage that, obviously. So
wonderful. And so, I have patients on right now and family members of patients and parents who have been saying, I don't know what to do to keep my kids entertained, and I've run out of ideas. What sort of things can family members use, or what resources are there that they can tap into to find useful things for the pediatric patient in general, but also special need kid? What resources are there?
So I think one is trying to have some kind of routine. Like this is a different time, so I think parents need to be kind to themselves. I don't think you need to have a school schedule like they were going to school. I think that's unrealistic. I realize that most parents are still working, whether it's in home or they're still having to leave home. There's multiple children, different, grade levels, but having some kind of, general schedule where you're going to get up, you're going to do a little bit of schooling, you're going to do, outside time or playtime or whatever, just something to kind of break up the monotony of day after day after day of being at home. And there are lots of places right now that are giving out free memberships to different educational tools. So I actually would just Google. I've been saving things as I go along and see them. But as a parent, I would literally just Google free resources because right now, because of all the things that are going on, there's free art, like virtual art museum tours. There's, I think, abc.com and other websites like that are offering free memberships. There's free concerts and all that kind of stuff. So it's a lot of things out there like that right now. So I would just Google and find some stuff like that.
No, I like that idea, the virtual museum tour. How does a parent go about introducing their child to the museum tour? If you were to give a couple pointers, and this is the first time they're thinking about this idea, what could they do to sort of introduce it or immerse the child into this idea?
So I think you definitely want to know what your kids' interests are. So for instance, my kids' attention span, it's not really conducive to a virtual museum tour. But they love music. So like Alvin Ailey had a free thing today. So then watch it, and that's education. I mean, that's art. So then watching something like that. If you do have a kid that loves those kind of things, like, okay, we can't go to the museum, but we can do this tour. It'll be pictures where you could go, just, pretend like we were in London, and see what's in there. And then you could, it's kind of, they have it set up interactive, so they'll probably teach you more than you teach them, because kids know the computers these days. But show them the interactive things that they can do with it, and then kind of make some kind of game or educational activity after to drive the point home. So right now my son is really into animals. So and he's obviously really into screens, because most kids are really into screens. So we'll maybe read a little something about animals, and then afterwards, when he's like, can I watch, screens? I'm like, yes, you can watch YouTube videos of the animals we just talked about. So that way it's like a win-win. You could go watch screens, but it's really something educational.
Yes, I like that. And speaking of screens, how much screen time is recommended for, say, kids under 7, kids 7 to 14 and older?
So I would say normally 1 hour a day, 2 hours a day max for teenagers. But I'm going to be the first to tell you that during this time, we have not been following that recommendation. I'm just doing my best to at least make some of it educational. I mean, I think right now, just do your best to kind of keep it reined in as much as you can. But the general recommendations is 1 hour for a day for younger kids and 2 hours a day for older kids. And kind of the way I recommend parents do it, instead of using screens as a punishment, which we all do. I mean, sometimes I even still do that. And I tell, like you need to sit down, and that's fine, but try to flip it the other way and let them do whatever they need to do. So do their chores to earn that hour of screen time every day, or their, you know, whatever it is that they need to get done for the day. Homework has to be done, and then you get your hour of screen time. So it's more of a reward instead of becoming that punishment.
And, you know, I like that you're saying so often to parents, cut yourself some slack, because I've certainly seen some posts where parents are really stressing out that they can't seem to come up with enough of a schedule for the children, and that it's not detailed, you know, and you're seeing things like #momfail and things like that. And so I'm glad that you're saying this, because, you know, we have to consider the adults in the home too.
Yeah, and if you're not doing well, they're not going to do well just by virtue of that. If you're stressed out, and we're not, well, some of us may be teachers, but most of us are not teachers. Teachers have their education for a reason. So we're doing the best we can right now. And, you know, I just think we need to, thankfully my kids' teachers, they start distance learning tomorrow, but they've been doing really well with preparing us, and all of the activities that they give, they say it's not supposed to take more than 10 or 15 minutes at a time. So I've just been saying, shoot for, you know, 1 or 2, depending on what all the kid has to do, 1 or 2 hours of school in a day. Because we're not going to do, you're not going to be able to do 7 hours of school for each kid at different grade levels. It's just not going to happen.